Welcome back to the Morning Blend. Well, people who suffer from endless sinus infections, congestion, and headaches now have some hope.
Yeah, our next guest did the first balloon sinuplasty in Wisconsin. It's a gentle, painless way to end sinus problems for good. Hundreds of happy patients later, Dr. Madan Kandula joins us with information on this procedure. He's a board-certified ear, nose, and throat specialist with the Sinus Center at Advent. Welcome back to the Morning Blend.
Thank you. Thanks for having me.
Nice to have you.
Thanks for being here. So you did the very first balloon sinuplasty here in Wisconsin.
Correct. Yeah.
And what was it that brought you to this procedure?
Back then it was groundbreaking. It was doing something that we always try to do. From a sinus standpoint, let me go this way. For folks who have sinus issues, a lot of the time, most of the time, their trouble is the fact that the sinuses aren't able to drain properly, and that either leads to infections. A lot of folks, it's just headaches where they just get pressure in the face, and it changes with changes in the weather like we've had here recently. And prior to this, there really, the option was doing nothing about it and dealing with it, or doing something active from a surgical standpoint, which was great, but there's a lot of folks in sort of who are in the in-between zone, and this was something that was in between, made a big difference, and it was something I wanted to be a part of.
We're looking at video of it here, and this kind of, I think, helps people understand the process, right?
I think our video just went away.
Oh, it just went away.
It went up to a close-up of your nose.
Exactly.
You're going to show us live on your sinuses.
But,
what kinds of things were done, though, before that procedure existed, before that was possible?
So basically we still do this. I mean, there are plenty of folks who this is not the right fit for, but for those folks, if they've got issues and we need to get in there and get the sinuses open, so we need to go to sleep, take a look in with a camera, and actually usually remove tissue to get the sinus passageways open. So that's sort of the standard technique, great for what it's a good fit for, not a great fit for everybody. So, yeah.
So exactly how then does the balloon sinuplasty work?
So with this, I guess we still don't have video, but anyway.
We're going to work on it here.
It's coming.
Is it? Oh, here we go.
There we go.
Here's our guy. So, so basically, it's the same concept. So we're going in just through the nose, and the trick of this is we're looking in the nose with the camera, looking up to where the sinus opening is, and on this side, we're looking with we're placing a catheter up into the sinus opening itself. A little light wire is used to find the natural sinus passageway, and once you find the right spot, then the trick is to put the little angioplasty kind of type balloon over top of that wire, and then we inflate that. So we're internally dilating the sinus opening without removing any tissue, without making any cuts, without doing anything really to the healthy structures that are there, and it's as slick as that. I mean, I guess I was, when I first started doing this, I wasn't sure how it was going to play out. I've been doing this for, I guess it's been 7 years now overall, and it's been remarkable, and it still is remarkable.
And since last year, you can do all of that right in your office.
Yeah.
And what is the benefit to it? I mean, my guess is that there's a lot less downtime. I mean, people traditionally, it seemed, who had sinus surgery were out for a long time.
This is really low key. I mean, I really think the in-office change has been a game changer, and it really has. I mean, so I wasn't sure about how that was going to work either, but patients tolerate it very, very well. It's very easy. Most folks, we do this on certain days of the week, and most folks are back to work by the next day. There's really minimal downtime. It tends to feel like you went and had a dental procedure done, like you got a filling done or something like that. So there is, when we do these procedures in the office, there's the front end where we're getting things numb on the inside of the nose, but very low key, and the actual doing it's low key as well. And it's been, I've been amazed with the changes we've been able to achieve in the office with things that I used to always have to take folks to surgery to have things done, which is fine, but that's a more protracted recovery, and this has been remarkable.
Yeah.
Were people kind of skeptical at first because it is so easy? And my question also is, will you have troubles after, or does it really have longevity to the procedure?
Yeah, and I mean, I'm a skeptic, and I think patients were skeptics too coming in. It's almost like a lot of folks were sort of, I don't know if they said this, but kind of, well, what's the catch? I mean, why wouldn't I try this? What's the real, story here? And, I mean, if folks were skeptical, I was skeptical, and it's proven itself. I mean, time and time again, there are folks that, that get remarkable relief from this, and sometimes immediate relief, and it is lasting. So we're creating changes in the bony openings. It's not just pushing soft tissue around. So when we're making those openings are open, and we go usually to about 6 millimeters, which may not sound like a lot, but that's a huge difference from a sinus standpoint, and those openings stay open. So the studies have shown that the odds of those openings staying open is about 98% as the years roll by, which is great.
Yeah, for sure. How do you determine if someone's a good candidate specifically for the balloon sinuplasty?
You know, part of it's their story. So what are they noticing? How are they noticing it? Part of it's what's, you know, what have they done coming into things? Part of it is what does their scan look like? So everybody who has anything like this done will do a CT scan in the office, which lets us know what's happening. And some folks, based on that scan and based on their story, are good candidates, and some folks, based on their scan and their story, are not so good candidates. There's really almost always something we're going to be able to offer for somebody who's having sinus issues. So if this isn't the right option, then a traditional surgery is a great option for some folks. And then there are folks who are in between where this may be an option, traditional surgery may be an option, and it's just a really educational process trying to figure out from their vantage point what's the right fit for them and moving forward.
And speaking of education, you have a great free program that's coming up a week from tomorrow. So it's Tuesday, March 19th. Again, it's completely free. It's happening at the Crown Plaza Hotel and Conference Center, which is on Watertown Plank Road, just east of Highway 100. There's the website there on the bottom of your screen where you can go to register. It's advent.md/event-form. And you can visit the Sinus Center at Advent. Call for a consultation at 414-771-6780. You're located on North Mayfair Road in Wauwatosa. Advent.md is your website. Real quick, is this often covered by insurance?
Yeah, pretty much all the time.
Great.
Fantastic.
Yeah.
Nice to have you. Thank you
Nice
so
to be
much.
here. Thank you.
Good to see you.